The official opening of the infectious disease isolation unit at the Mbagathi Hospital came on the backdrop of a warning by the World Health Organization Director General Tedros Adhanom to countries that had not set up facilities that the corona pandemic was not a drill. The global health body also identifying Kenya as a high-risk country.
We are preparing ourselves so that we are able to respond immediately. We have procured sufficient personal protective equipment for our workers. Let's never forget, the first line of defense is our workers.
Kenya seemingly heeding the call with its 120-bed unit that, together with the 11-bed facility at the Kenyatta National Hospital, will offer isolation and quarantine areas for those suspected or infected.
This is not an isolation facility. This is an isolation and treatment facility, and is the only one at the moment that we have around here.
A person exhibiting signs of the disease will be brought to the facility. Nurses dressed in protective gear will receive the patient and wheel him or her to one of the wards fitted with state-of-the-art machines, including scanners and test kits. To contain the spread of the lethal virus, anyone whose test results will come out positive will be confined in a special room awaiting treatment. While isolation units in other countries are seemingly sealed to ensure the contaminated air does not escape, there is rising concern over the safety of patients within the Mbagathi Hospital due to the open wards.
We have ensured that this place is totally isolated from the rest of the facility, and when we are taking you around, it's only that the windows were like that because there are no patients in the facility. Once we have an individual case, the necessary measures that we are going to put in place are totally different.
There are rooms that have already been fumigated, and I would also like to assure, even where we went through, they are going to fumigate after we leave.
The CS revealing that over 1,000 trained personnel had been deployed to the airports, the seaports and all border points to facilitate screening. 5,000 more would be deployed to counties to train health workers.
I have heard people say, I passed by the place and I wasn't screened. You were screened. You just didn't know that you were. So let me make it clear. Nobody is going to come into Kenya without screening. Next week, the Ministry of Transport will hold a meeting with transport industry players to sensitize them on the role they can play in mitigating the effects and spread of the deadly virus. Members of the public are encouraged to remain vigilant as the risk is still high. Let's maintain basic hand and respiratory hygiene and safe food practices. Once again, the health CS calling on those advised to be on self-quarantine to heed the directive. With this 120-bed capacity isolation unit, the government says it is confident that it can tackle the coronavirus if it ever gets here. Meanwhile, efforts are now channeled towards ensuring that county health facilities are also at par to ensure the virus is fought from both levels. Chamutai Gwin, Citizen TV, at the isolation unit, Mbagathi Hospital.